We are recognizing National Public Health Week, and the theme this year is building bridges to better health. This year is so important for so many reasons, but too often we take public health for granted. It's like having four solid tires in a car. It's not until you get a flat before you really start focusing on needing those tires. Public health is what is the infrastructure that without it, nothing else absolutely works. And it can have tragic consequences if not addressed fully and holistically. The data is clear that when we take action backed by public health science, health outcomes improve. Rebuilding doesn't mean going back to where we were before the COVID pandemic. Rebuilding means actually taking the lessons learned from this last year and addressing the issues once and for all that we knew were there prior to the pandemic. Joining us this morning are Dr. Raymond Kroll, our Director of the Department of Health and Human Services, Dr. Travis Gales, our Health Officer, Dr. James Bridgers, our Deputy Health Officer, and Dr. Christopher Rogers, our Policy and Strategy Officer with Public Health Services. I'd like to turn it over to Drs. Kroll and Gales to say a few words, starting with Dr. Kroll.
Yeah. Good morning. Thank you, council members of the council and Council Vice President Albornoz for putting this proclamation before us today. I want to say this is a public health week unlike any other public health week in our lifetimes. COVID has given new meaning and new focus on public health. This year, we have all become public health warriors in this fight against COVID, including the council, the county executive, the staff of public health and health and human services, and the many volunteers and thousands of residents of this county who have worked throughout this past year to keep us safe and protected from COVID. I want to say a special thanks to Dr. Gales and Dr. Bridgers, two gentlemen who have been the calming and thoughtful voices of public health and helping to guide this fight over this past year. Gentlemen, I very much appreciate all that you have given to the county on our behalf. As we would honor the memories of hundreds of thousands of people who've lost their lives to the pandemic, let us use this National Public Health Week to re-energize ourselves, to continue to build bridges and create health, to work our way out of this pandemic and through the hardships that it has brought. Long past the time of the pandemic and the virus, we're going to be rebuilding bridges and doing a lot of work that is necessary to build health. So I thank you for this proclamation this morning, and I'll turn it back over to you, Council Member.
Thank you, Dr. Kroll. Dr. Gales.
Good morning, everyone. I know we'll be talking shortly and you'll have to hear me for a much more extended time. So I just wanted to take this opportunity to say thank you all for your support. Thank you to Dr. Kroll and HHS, but a big, huge thank you to the folks who are executing the work, whether it's COVID or non-COVID related issues. Dr. Bridgers, Dr. Rogers, and the rest of the Public Health Services team who breathe and bleed public health on a daily basis. And I would like to send special recognition to all of our staff who have been working on non-COVID related public health stuff, because we've had to continue operating all of our clinics through all of this, all of our screening programs from breast cancer, cervical cancer to colorectal cancer prevention programs, our dentistry program, TB, STI clinics, all of those folks who, while most of the attention has been focused on COVID, have continued to execute those public health principles and practices that we've had in place for many years. We're excited to continue to build on that work. Again, I just think of our licensing and regulatory services team, our HIV team. So lots of folks doing lots of great things who have not only continued to execute and move those programs forward, they have contributed and participated as part of our COVID response. We are thankful to be in a jurisdiction that understands and values the contribution of science and clinical delivery and clinical data in terms of informing decisions as they're made. And we continue to look forward to working with you all as we get to the finish line of this pandemic. And as Dr. Kroll laid out, continue to chip away and address those longstanding systemic issues that continue to plague our society. Thank you.
Thank you, Dr. Gales. And on behalf of all of my colleagues, I want to thank all of you. Our public health team has been extraordinary this last year, and well before that, you have literally been saving lives, working around the clock, and also want to acknowledge public health officials across the country who've sacrificed so much, who've been attacked personally and verbally for just trying to keep us all safe. So thank you all so much for your leadership. And it now gives me great honor to read this proclamation this morning. Proclamation of the Montgomery County Council. Whereas April 5th through 11th, 2021 is National Public Health Week, and the theme this year is Building Bridges to Better Health. And whereas since 1995, the American Public Health Association, through its sponsorship of National Public Health Week, has educated the public, policymakers, and public health professionals about issues important to improving public health. And whereas Montgomery County's Department of Health and Human Services continually strives for excellence in serving our residents and has completed the rigorous process to meet the National Public Health Accreditation Board program, which is supported by the Centers for Disease Control and Prevention and the Robert Wood Johnson Foundation. This program sets standards for the nation's nearly 3,000 government health departments to continuously improve the quality of their services and performance. This achievement was initiated by the late Dr. Older Tillman, who was Montgomery County's former health officer, and led to the finish line by our current county health officer and chief of DHHS Public Health Services, Dr. Travis Gales. And whereas the COVID-19 pandemic has pushed the importance of public health into the spotlight and illuminated the long history of racial inequities and health disparities that clearly prove that racism is a public health crisis. And whereas public health also includes implementing strategies to meet the behavioral health needs and substance abuse prevention and treatment for our community members, including the children, youth, and families who are experiencing the significant impact that COVID-19 is having on emotional, psychological, and social well-being. And whereas now is the time to strengthen our public health systems nationwide, not only to ensure the end of this pandemic, but also to continue to improve health conditions for all and to prepare for the future health challenges that will most certainly face us. Now, therefore, it be resolved that the County Council of Montgomery County, Maryland hereby recognizes National Public Health Week 2021, and be it further resolved that the County Council calls upon our residents to observe this week by helping our families, friends, neighbors, coworkers, and leaders to better understand the value of public health and work to adopt preventive lifestyle habits following this year's theme, Building Bridges to Better Health, presented on the 6th day of April this year, 2021, signed by myself and our council president. Congratulations and thank you for your hard work.